The man that we're about to interview, Thomas Watson, I am telling you for free that we are going to be interviewing him more and more and more and more. In fact, I've already invited him to, if he wants to even join us once a month, because of the incredible information that he has. And there is so much behind the story. But first of all, Thomas, welcome to Plays It In.
Hey, good morning, everybody. It's great to be here, and thanks for the opportunity. Really appreciate it.
And if you happen to hear a touch of a twang, it's because...
A little bit of Scottish.
A little bit of Scottish. Yeah. So who made the move from Scotland? Was it the parents, or did you do it alone?
It was the parents. I was 11. I had no choice. I had to come with.
Oh, shame.
And that was 1975, and it was the best thing ever. I love it here.
And have you gone back and visited home often?
Oh, yeah. I go back every 1 year. I was there 2 months ago.
Oh, really?
Yeah. My brother's there and aunts and uncles, so...
I always get so excited when someone from the so-called first world comes and moves here and they love it here. It's my best. But we're going to get straight into it because Thomas, I promise you, he will be back with us and he'll be chilling with us. But he is, it's not even a paramedic. You're so much more than that.
Well, I think, if I may, just to go into what pre-hospital is. So as doctors and nurses, predominantly you're trained to work in a hospital, right? And probably 50 years ago, I got involved in South Africa, in Johannesburg, when I was practicing, where we came up with the paramedic initial diploma, and now we do a 4-year degree. So the word paramedic is used very lightly. Everybody thinks everybody on an ambulance is a paramedic. Not the case. They've been trained in basic, intermediate, but the paramedics are the guys and girls in the rapid response cars and the helicopters. So the other guys do a fantastic job, but they're limited in their practice by comparison.
So a paramedic, they can they do drips and things like that?
We do drips, we do the drugs, we do intubation, we do the cardioversion, we do everything you can think of under our own license.
And some other ambulance drivers and or people on ambulances, if they're not paramedics, what is it that they cannot do?
Well, they're limited in terms of their practice. We work within a framework of protocol. So as you progress, your protocol gets bigger. So as a basic trained ambulance person, I hate to call people ambulance drivers because we all drive a vehicle to get there, right?
Oh, okay.
So it's a basic trained person, limited, and then intermediate can put up a drip and use, but they can use AEDs from the beginning, from the get-go. The paramedic is our whole practice on its own. Whatever you think of an ICU or emergency department, we're doing pre-hospital.
Good grief.
Cricothyrotomies, we're doing drugs, tubes, ventilation, everything.
For those of you who aren't on our TikTok, we are live on TikTok as well. If you want to, we are radio you can watch. So you're welcome to join. This is Mo as well. Mo is co-hosting with us. So Mo, if you've also got any questions, you're welcome. I know that first of all, I'm telling you right now, we're going to be late for news and or news is not happening at 8:30 because this is such a great story. May we quickly, I was just talking to Thomas outside and I found out what happened to him that got him interested in medicine. May we just touch on that briefly?
Sure.
So you were how old? 15? 15 years old.
Wow. I've been in the country 4 years.
And his friend from school, grade 10, standard 8, invites him to come to his house because, and this is not even a boys are boys, but hey, grandpa's got a gun. Do you want to see the gun? And then what happened?
I said, sure. What do you mean, do you want to see the gun? Of course I want to see the gun. So I went to his place after school. His mum was in the kitchen. They were Italian, South African, so she was making a nice pasta.
Oh, free food, yes.
Bargain, I'm going to get free chow. And then in those days, we didn't have cell phones, guys.
Yeah.
It was a phone with a wire and you dialed, right?
Yeah.
Oh my God.
So he went to the bedroom. I was in the passage. And I said, I'm just going to phone my mother quick. No, I'm just going to the bedroom. And while I'm phoning, he came to the bedroom door pointing the shotgun at me, not a handgun. And he said, here's the gun. I said, okay, stand by. I'll be there now. Wow. Bomb went off. Sure. I was nowhere near it. Hit me in the chest, went through my arm. His mother thought the fridge had blown up. Wow. I picked myself up, went to the kitchen, collapsed, woke up outside in the driveway. I'm bleeding from an artery that's blown away. My chest, my lungs collapsed. And 4 adults standing, watching me dying, doing nothing. And I thought, there's got to be a better way, man. This is crazy. And then got to the hospital, ambulance, boom. And I remember the doctor saying before I went under, this kid's going to lose his arm. And I thought, oh, no, man, this is getting worse. And I woke up the next day, and I still got my arm 50 years later. And I think that's when I decided I'm going to be a paramedic. And that's been my journey for 42 years.
And I was just saying outside to Tom, isn't it amazing that I don't know how else to say it other than God, and call God whatever you want to call God, but God saved this man's life because his path is to save lives.
I love it.
And we wouldn't have known that that was your path unless you'd experienced that yourself. Do you now have, outside of a couple scars, are you back to complete, like 100%?
Oh yeah, I've run comrades. I'm a runner. I fly privately.
You got shot in the chest by a shotgun?
My God.
Listen,
That
you
is
decide you're either a survivor or you're a victim. And I decided I was a survivor from that day.
Wow.
And nothing has hindered me.
There is nothing elementary about that, my dear Watson.
Yes.
I like that. Right?
Very nicely done. Okay, so you have, and I know that you've done many years now working in this
pre-hospital
pre-hospital
care.
emergency care, and I know for a fact that we're going to have hours and hours and hours and hours of content with you. Today, we're speaking specifically about a heart attack.
Yes.
And about how we, as the common man,
yes.
what we can do.
Right.
And then you mentioned something earlier. It's 3 letters that a lot of us have seen and not many know. And the letters are A, E, and D.
Mm-hmm.
And I'd love to talk about that because I see, and boys, if you see in front of Tom right now, he's got a tiny little, looks like a fat cell phone.
Oh,
And we're gonna find out about this fat
AED.
cell phone because that thing in his left hand there, it's worth the same amount as a cell phone. The only difference is while a cell phone is stealing your life while you scroll TikTok and Instagram, this little pocket AED will save your life.
wow.
So let's...
Yeah, if I may.
Please.
So what I decided here, I moved on the North Coast 6 years ago from Joburg, and we're in Salt Rock. And in my time here, I have witnessed personally 3 people die outside of the hospital from sudden cardiac arrest. In other words, no warning. The one was a 15-year-old boy.
What?
Yep. No warning. It's like you switch the switch of the light off. That's it.
And does someone literally go from sitting
From
here
speakerphone.
chatting and
Yeah.
and I mean, I don't know how to say this because obviously if it's someone you love,
Yeah.
but from a perspective of how a human goes, do you reckon there's any pain or anything? Do you think they just gone?
Switching a light switch off. Now,
That's
let me
kind of a
explain
good way
you.
to go. I don't know.
So I've started a campaign called Heart Safe Dolphin Coast.
Okay.
And it's a logo of a heart with an automatic defib sign. And within that, we discuss heart attack and cardiac arrest. Now, heart attack is a warning. That's when someone has chest pain. That's when someone is conscious. That's when they explain it's like pressure, like an elephant sitting on the chest, pain going in the arm, nausea, vomiting. That's the warning. That's your heart under stress because one of the arteries is partially occluded.
Partially occluded meaning blocked.
Yep. Okay. So when that artery blocks totally, the blood cannot get to the heart muscle, and that's when your heart goes into cardiac arrest. Right. So the partial blockage is the warning.
So that's a heart attack?
That's a heart attack.
Can
You might get the heart attack warning, or you go straight to cardiac arrest.
So a heart attack won't necessarily kill you.
No, but it's a warning. If you don't do something about it, it will kill you.
And then a cardiac arrest, that's it.
No warning. Any age, no warning. Switches off. Switches off. So your heart's beating, okay? It doesn't just stop. It fibrillates. So it's still moving, but it's not pumping. And that's where the automatic external defibrillator comes in because your heart's in fibrillation. We want to shock it out of that rhythm. So CPR is 50% of the solution and the shock is the other 50. And every 1 minute that goes by that you don't get a shock and CPR, 10% less chance of survival. That's a fact. So if everybody's standing, waiting for the ambulance, I don't care which service it is, private, government, here, New York, London, they'll never get to you in 10 minutes. Never. Listen to what I'm telling you. So as a community, if we don't have people trained and have AEDs on our community in schools, in corporates, on the beach, at the shopping malls, waiting for the ambulance isn't going to work, especially in this cardiac arrest. It means you're dead.
Are you able to just, by using your voice, and obviously for anyone on TikTok, and we'll post this afterwards, would you be able to give us a quick crash course on how we use that?
Absolutely.
Let's go.
First of all, how do you recognize cardiac arrest?
How?
Someone's lying on the floor, that's not normal, or someone's slumped in a chair, okay? How's the response? Are they unresponsive, unconscious? Are they breathing? No, that's cardiac arrest. We don't even feel for a pulse, forget it. It's too complicated.
So it's not about looking at pupils or looking at...
So as we are looking here, you're all looking at me, it tells me you're conscious, you're breathing, you must have a pulse straight away, 1 second.
Yeah.
But if it's not that, then if you're unconscious, no breathing, you're dead. Then we have to call for the emergency services. So it's recognize, call. Who do we call? What's the number? What do we tell them? And then act before they get there.
Which service would you call here? Because let's say, for example, person X is lying on the floor. I don't know them, but I can see they need assistance. So that means I also have no idea whether they are medical aided or not. And unfortunately in South Africa, and I think anywhere in the world,
private, yep.
And when someone arrives, I think the first thing they ask is, do you have medical aid?
Exactly.
So in order to get this person help, who would I call?
So do you have a cell phone?
I've got a cell phone.
Did they tell you the emergency number to phone when you bought the cell phone?
No.
How strange is that, right?
It's very strange.
Crazy. So the number to phone is 112. We've got all the different numbers for the private services and the government services, but if you phone 112 from
any
your cell
phone.
phone, it will jump from any cell seat to
Vodacom,
Vodacom. It doesn't
anything.
matter. You don't even need money on your phone. You don't even need anything, and that's one number for anything. Police,
112.
ambulance, fire, plumber, electrician, whatever.
So you're saying even if I've got no airtime, I can tell my children, as long as they obviously need battery and a reception, but 112.
112.
So with Samsung, if you tap the power button
Same
3
here.
times.
5 times on the iPhone.
Okay, so if iPhone 5 times power button quickly and Samsung 3 times or 5 times quickly, and it automatically phones.
Goes to emergency. So it's not the power button on the iPhone, it's this side button here. 1, 2, 3, 4, 5.
Who does it go to?
It goes to...
the
Oh, good.
emergency call. So when I was flying overseas, true story, I was flying on an emergency service in Saudi Arabia. We got mobilized, listen to this, on an iPhone
Oh, shame.
watch.
Let's just let them know that you were just doing a...
No, stop calling, it's fine.
Okay.
The person's iPhone activated because of a hard impact. We got the coordinates from their phone, from their watch. They didn't speak to us. We activated on the watch and we landed at the scene and saved them.
Wow.
What?
I promise you, it's just crazy how the technology's come in. But it's recognized the emergency.
Recognize.
Who do you call? Would you tell them?
112.
And then act. So if someone's unconscious, not breathing, they're dead. Here's the question, can you make them deader?
No, I can't make them deader.
You can only make it better, right?
Yes.
So we're going to do compressions on the chest 100 times a minute to the tune of Staying Alive. And you can play that tune afterwards. You'll never forget
Staying
it.
alive, staying alive. And that's how you know how fast to be giving the compressions.
Correct. 100 times a minute. But get the pads on. Can I show you this quickly?
Please, absolutely.
So this is the one that I supply. Just a punt there for me.
Yeah.
It's called the Pocket AED. It's the size of a cell phone, and it weighs 700 grams. Okay. Usually the bigger ones in offices are a bit bigger.
Because, I mean, those
But
are the
it does
ones
the
you see
exact
up on
same.
walls.
Yes,
and
at
they're
the
quite
airports and the
Yes.
does the exact same thing. Green button to switch it on. Orange button will tell you it's charging up. In the meantime, it will say put the pads on bare chest, not on the clothing. It's got to be on the patient's bare chest. Then it will say push flashing button to shock. You push the flashing button, you'll see the jump of the patient because it's a shock. And then it will say carry on CPR. As soon as we give a shock, we carry on CPR.
A quick question, and
Yeah.
it's a question that's also come through now on our WhatsApp line, Tom.
yes.
What if someone's fainted
Yes.
and you misdiagnose the faint as a cardiac arrest? You put the pads on them and then you shock them and hurt
No,
them.
you don't. You can't. The machine is programmed to know shockable, non-shockable. It will not shock
If there's a heartbeat.
If I put this pads on you right now, it will say no shock advised, check for pulse, continue CPR. That's it.
What
It
if
will
it's a
never shock.
child?
If it's a child, good question. This grey button here,
Yes.
same pads. So here's the pads at the back, loaded in the back of the machine.
Are they one use only, the pads?
One use only, because it's going on the patient's skin, right?
Okay.
So you stick the pads on while you're doing CPR. Don't stop the CPR. And then if it's a child, you push that button there, and it goes down to 50 joules of energy.
So less of a
But the
shock.
same pad. So it saves time. It saves changing pads. You never plug this thing in.
Okay, so hold on a second, Tom.
Yeah.
I have to ask again.
Yeah.
I'm alone.
Yes.
Person X is on the floor.
Yeah.
I have your pocket AED with me.
Yes.
But you're telling me not to stop CPR.
Well, if you're on
So-
your own, obviously you would have to
So
stop.
what would
because-
my first thing be then? Do I start compression, then put those on?
No. Get this on as soon as possible.
First
because
things
this
first.
is definitive for fibrillation. This is what gets them out of it quicker. The quicker we shock them, the better chance of survival. Every 1 minute that they're not getting a shock, 10% less chance of survival.
So what I'm doing at this point, I phoned 112, maybe I've got it on loudspeaker so I can get this going.
Exactly.
Once they answer, the first thing I'm going to do is let them know cardiac arrest, where I am, and then I'll just stay on the phone, rather let them put the phone down in case they have more questions. I'm putting that on top of the right chest, underneath the left chest, which it'll be telling me what to do, and then the AED will speak me through this.
Everything.
So
and
even if
also
I've
on the
never
back,
used it.
It will show you step 1, step 2, step 3, step 4 in a pictogram, and audibly you'll hear it tell you what to do. Apply pads to patient's bare chest, stand clear, analyzing rhythm, push flashing button to shock. Anybody can use this. Anybody.
If it's a woman and she's got jewelry on, do we need to remove the jewelry?
It's a good point. There's been a big international study saying that women have got less chance of being resuscitated because of their bra and breasts. Now, guys, we've all got breasts. We've all seen breasts in an emergency. Cut off the bra, get the pads on, and be cognizant.
The bra because of the metal?
Yes.
Okay.
But it's not an absolute no. Just get on with it. One pad there.
I don't think she's going to mind if her boobs were out.
Hands up, would you like to be saved? Should your heart stop?
Yes.
Hands up, do you know what to do? Should someone's heart stop right now?
No. I'm getting there now. No. Yes.
That's the message from Heart Safe Dolphin Coast. That's what I'm doing. I'm teaching. I'm going to be doing community first response. There's a whole lot of stuff that's going to happen.
All right, so now someone's had the heart attack.
Yeah.
We've called 112. I just want to keep going over this because I want to make sure. I mean, hopefully no one listening to this will ever have to use this, but
hopefully.
If one person does.
Rather have it and not need it than need it and not have it.
So now I've put the AED on.
Yeah.
It's shocking. It actually thinks this person needs to be shocked. It's going. Am I doing CPR while the shocks are happening?
No. So it will shock, and straight after the shock, you start CPR for 2 minutes.
And when we say CPR, we're not also using breath?
No. And I'll tell you why. Think of it logically. When we're compressing, we're forcing the blood around the body and the oxygen. When you push down on the chest, that's a positive pressure.
So that's an exhale almost.
Exactly. When you come up off the chest, it's a negative. They're breathing of their own.
The lung actually inflates itself.
They're breathing of their own. So you don't have to stop, because stopping compressions is bad. Stopping the flow is bad. Just keep on the chest. Just do the shocks as required. And if you see signs of life, start moving, start sitting up. Fantastic.
I've got a question coming through here as well.
Yeah.
Let me just see here. Saying, I've heard that when you do CPR, you have to break the ribs. Is this true?
No, you don't have to. But what happens is a consequence, you may break them. So here I'm going to tell you again, if I drop down dead and you know CPR, get on my chest. If you break my ribs, they can fix it in hospital. It's not a life-saving,
So we mustn't get a fright if we hear that crack.
the ribs at the sternum.
Yeah.
It's not so much the ribs cracking, it's the cartilage. It's the ribs coming away from the sternum.
So you can get towards the heart for the compression.
So as you push, you might hear crack. Carry on. Just keep going. We can fix that afterwards.
And how long do we keep going? When do we know when to stop?
You don't stop until we get there.
So you don't stop until there's a doctor, a paramedic.
You don't stop until we get there, and we say, and even when I get there, I'm going to say, Keri, carry on. I'm getting my gear ready. Don't stop.
Okay, now, again, random question, but I'm not someone who exercises. I'm trying. I'm so tired. I've been doing this for 15 minutes.
We've got the two guys in studio. I forgot your name. Sorry.
Devek and Mo.
Devek and Mo. You're with. And every 2 minutes we're going to swap, because it is tiring.
Okay, so how do you do the swap? How would we do a swap then? Do you almost count together and say, I'm passing to you now in 3,
exactly.
in 2, in 1,
so
take over.
You'll be on my right, I'm compressing on the chest. Are you ready to swap? His hands are next to mine. And as we say 3, 2, 1, he slides his hands, slides my hands away and carries on. Minimum interruption. That's the song.
Do you think it's easier to do this if you know the person? Because you have this will to get them going?
If you know the person, it's harder. Mm-hmm. It's harder because there's extra pressure on you now, because you know the consequences. So even as medical professionals, if it's one of our family, we'd rather one of our colleagues do the treatment. If I'm there and it happens, I'll do it. But out of that emotional thing, it is very hard to do it on someone you know, for sure.
If the person, I put the AED on, and they're finding there's no electrical impulses.
Yes.
Will the AED say the person's dead?
Advised. No, it will never say they're dead. It will say no shock advised. Check for a pulse. No pulse. Continue CPR. And remember, the 10 minutes is because the heart goes into that fibrillation for 10 minutes. It doesn't go into the straight line you see on TV. That's asystole. We don't shock that. An adult goes into fibrillation for 10 minutes, up to. That's the window of opportunity to shock them out of that.
Only
because
10 minutes.
We're just resetting the normal pacer. That's all we're doing. It's like when the lights trip, what do? You reset
DB.
the DB board. We're resetting the DB board. That's all we're doing, but we get 10 minutes.
How often do you defibrillate? I mean, in that 10 minutes?
Oh, you could defibrillate every 2 minutes, 5 times, easy.
Okay.
There's no maximum amount of defibrillation. It's relative to the rhythm, but the machine's programmed.
But it will tell you
understand the
everything.
rhythm. Yes.
So you don't have to try and imagine yourself.
You don't have to know ECGs, nothing. It's all programmed, shockable, not shockable. That's it.
Okay, so now if someone's listening or watching, and again, hopefully we never have to, is this something that you carry in your car? Is this something that every household should have? Like, because you think about an AED. Guys, do you have AEDs anywhere at home or at work? Do you have one at your
Let me
coffee
ask you
shop?
this
It's the
question.
first time I've seen one.
They've been around for 40 years.
Wow.
Okay. Let me ask you this question. Do you see fire extinguishers?
Yes.
We should have AEDs where we see fire extinguishers. We need AEDs with this public's everywhere. So me, personally, because I know, I've got this with me all the time in the car, always. Okay? Should everybody have? Not necessarily. But if your family's predisposed to a heart problem, yes.
How do you know if we're predisposed to one?
You've got hypertension, you've had a heart attack already, what. Then, if an elderly parent or something, you're worried about them, they've had the heart attack, it's a good idea to have one of these things. It's the same sort of price you're paying for your cell phone, guys.
I've got another question coming here. What if someone's had an up where they've got metal in them? Can you defib?
Yes. So sometimes people have got pacemakers under the skin, right?
Yeah.
So you just place the pad below it instead of on top of it.
But how do you know?
Away from
Oh,
it.
you can see a pacemaker
You
through
see
the
a
skin.
pacemaker.
Okay.
If they've got a rib that was wired, or they've had a bypass where there was wiring, it isn't going to do anything really.
Okay.
It's not going to blow a hole in the chest. The pacemaker will. Don't put it on a pacemaker. Put it away from it.
That's so scary.
Oh my God!
But here's the thing. You cannot make someone who's in cardiac arrest deader. Please do something, even if you get how many compressions it is. I don't know if you heard last month, there was a guy in Salt Rock that saved a 3-year-old kid that drowned in a pool. I'm seeing him after this interview.
What happened?
He was the neighbor. He heard this commotion. His neighbors were on holiday in Bali, where I was, just coincidentally. And the domestic was at home cleaning, and she had her son there, and the kid fell in the pool. And the neighbor heard this, went over, started the CPR, called the emergency service. Kid came back. They got him to the hospital. He survived, no brain damage, discharged the next day. That is an awesome story, and I'm seeing him after this talk.
We should interview someone like that.
No, but this is the thing is I really think that these kind of interviews, beside the fact that it's just a human thing to be intrigued in stories like this, because we all have a thing about mortality. It doesn't matter who you are, how wealthy you are, we all have an end date. We're all in
Absolutely.
essence standing in line for the
Absolutely.
ride, and the ride is heaven. We
Absolutely.
just don't know how far we are to the front.
Thankfully.
Yeah, and we would like to think we're all going to make it into old age, but we don't know. When it comes to a drowning, do you defib?
So, interesting question. It depends how long they've been underwater, number one. Number two, children usually don't go into a shockable rhythm. They go into the straight line, and purely the CPR is what worked in that case. He didn't have one of these. But the CPR kids respond quickly to CPR and oxygenation. So kids, we would breathe.
You would breathe with it. And so for those people listening, and Tom, we are going to come back, and I'm sure everyone will agree. We've got so many different facets
there's so much stuff I want to
of
share with you
emergency
guys.
medicine.
Absolutely.
But I think every moment is a moment that someone could really learn. When you say for a child like that, we would breathe. We know now that we're going to be going to staying alive. We want about 100 beats a minute.
Whether it's a child, an adult,
For
doesn't matter.
a child
100,
also.
100.
And then when would you breathe if you were doing the breath as well? And this day and age in South Africa, is it legal for me to mouth, or do I have to have a cover?
No, it's legal without or with. The problem is with mouth to mouth, and I don't want to scare people.
No.
They're going to vomit.
If they've been drowned because of the
If
water.
they're dead, they're going to vomit because they've got no control over the valves, and it's just going to come out. And that's the unpleasantness. So it's better to use a mouth-to-mouth device.
Yes.
But you need training for that.
For the mouth-to-mouth device.
Absolutely.
Okay.
It's a whole technique, and But that's why it's easier hands-only CPR.
Yeah.
It's quicker, it's easier to remember, and with the AD, we can save someone until the emergency service gets there.
But let's just get the answer as well, just in case.
Yes.
It's a child, there was a drowning, we do need to put air in, whether there's the device or not.
Every 30 compressions,
Every
you give
30.
2 breaths.
Every 30 compressions.
2 breaths.
2 breaths. And for the child, because it's a small thing, do you breathe over nose and mouth?
You
do you
can.
cover the whole thing?
You can,
Or do
but
you still block?
You can breathe over mouth and nose.
If they're small.
And the whole idea is how much air do we give them?
Oh, yeah.
Enough until the chest rises. Because we don't have measurements and tapes.
So if you see the lungs
If you
have
see
gone,
the chest rise, that's
you've
enough.
done it.
Don't keep blowing. As soon as the chest rises, there's plenty. Carry on. Same with an adult. If you're breathing for them for whatever reason, enough until you see the chest rise.
Wow. And then how far do you push your hand for CPR?
oh, good question.
So-
I didn't ask that.
So it's 1/3 of the circumference of the chest. Okay. For an adult, it's 5 centimeters. It's deep. 5 centimeters.
You've got to push
especially-
down 5
So
centimeters.
if you're getting on a big guy's chest, okay, 5 centimeters, 100 times a minute, and that's why you've got to change every 2 minutes because you get tired. Okay.
And that's why the sternum might have a little crack.
It might have a little crack, especially if it's an older patient. They've got osteoporosis. They're more prone to fractures. But don't let that stop you, please. They can fix that in the hospital.
Can the person, okay, so let me go back to the placement of the hands. You
Yeah.
said 1/3 of the circumference, so how do I know where that is?
So with the kids, if it's a baby, an infant, you're going to put your hands around the chest, 2 thumbs, 1, 2, 3, 4.
so you
5,
obviously
6,
don't use a
7.
whole hand on a baby.
On a child, you use 1 hand.
So a baby, you just use your 2 thumbs.
2 thumbs around the
So
chest.
that's up to what, like 2 years old?
Up to a year.
Up to a
Depends
year?
on the size of the kid.
So from about a year to,
10, 11, teenager.
then it's one hand?
Might be more because you could some
Depending
big
how big
kids,
the kid
right?
is.
And then adults, it's 2 hands.
And then, sure, but I forgot what I was going to ask now. It was with the kid, the pressing. Oh, my other thing was, is there any legal something? So let's say, again, person X, and
Yes.
I've done, and I actually was sitting at lunch having a wine, and then I see it, and so I go and I perform CPR, I do mouth to mouth on them.
Yep.
Then their parent or whoever says, this girl that had alcohol,
Yep.
and it's haram, and yes, my son is saved, but alcohol and
Whatever.
I mean, I wasn't on duty, or I'm not a paramedic, but
Yes.
the person is safe, but now they want to take, there's consequences because their ribs are cracked,
It's a great-
and
it's
I
a
used
great
booze,
question.
and I had booze.
I can tell you that Islamically, if you're saving someone's life, you're allowed to use alcohol, like, to sanitize.
Oh, okay.
Or to do CPR.
Even if it's
you
my mouth to your
yes,
mouth.
it's fine. And if you're ill, you're allowed to consume not alcohol.
But if it's like in the droplets
in
or
the
the cough
medicine,
mixture.
medication, yeah.
Okay.
So
Yeah.
here's what I'll tell you. In South Africa, we have something similar to the Good Samaritan law, but it's not really. But this is how it works. You as a layperson with basic training or no training, not a professional like myself, see something happen, and as a human, you go to help. That's a good thing, number one. Number two, you did CPR because you saw it on a movie, whatever, and you saved that person, but you broke their ribs. The family can sue you. I can sue you because you're wearing a green top.
Oh, I
don't
see.
like it.
I see.
You with
Anyone
me?
can do anything.
Anybody can do anything, right? But don't let that stop you from doing the right thing, because I think inherently human beings, no matter who you are, what color you are, what you believe or don't believe, want to help.
And if the person doesn't survive?
That's what we call the debrief. Now we've got to debrief that and talk around that. And even within our profession, we debrief. We say, okay, guys, let's go through what we did. Could we have done this better, that better, what? And we debrief as a team. Because to walk away from that without debriefing, I don't know how you've put that in your mind. I don't know how you're dealing with that. You with me? So we do a debrief.
And it won't ever be, I mean, it's not my fault. I never hurt the person. I
No.
never knocked them over.
Listen,
or
even with this, it's not a guarantee. Okay? It's not the solution. Maybe the pump is so damaged it cannot pump.
Oh,
Are you with me?
yeah.
There's 2 guarantees in life: death and taxes.
Yes, we just take our life for granted here, guys. It's such
Absolutely.
we wake up every
Absolutely.
morning
Yeah.
and look at our phones without going, guys, I got another day. Because you know how many people didn't get today? And here we are, we've got today.
Absolutely.
Yeah.
Absolutely.
I mean, the anxiety, I'm feeling it already. Like,
Even
I
me.
feel like I need to save someone's life. And
Well,
I don't know if
like I
I'll show
said,
up.
that's what I've started the campaign on the North Coast to start with,
Yeah.
and then I'm going to throw this out. But rather have a plan,
Yes.
rather have the knowledge and not use it,
Yes.
than not have it, and then in that panic, critical thing, it's just crazy, right?
Sure.
I mean, I'd love to save someone's life. Like I would.
I'd love to be able to. That's it.
Yeah, but that pressure and anxiety.
Tom, before we let you go, let's just quickly go through the steps again, and then also if someone is interested in getting a pocket AED for their business,
I'll give you my address,
or for their offices
website,
or something.
Yep.
So let's just go through it again. We notice someone is collapsed, slumped,
so it's
unconscious. Recognize it.
So it's RCA, recognize, call, and act.
Recognize, call, and act.
That's it. So you recognize something happening.
Yeah.
Okay, you get to the person, hello, can you hear me? If they're not looking at you, that's
They're not responsive.
Normal. They're not responding. So no response, unconscious, check for breathing, check the chest, feel at the side of the face, no breathing. That's cardiac arrest. We're not even teaching, feel for a pulse. Where do you feel a pulse? Let me ask you that. Where do you feel a pulse?
I would presume neck.
No, that's a good one. But you're feeling it with your thumb. We never feel with the thumb.
Yeah.
I've got like...
You're going with that sort of. Next to your Adam's apple to the carotid and the carotid, that's where we feel. But if someone's got a short, fat neck and you're in a panic, I want you to feel your radial pulse by your thumb.
Is it true that you mustn't use your index because your index has your own pulse?
Mustn't use your thumb.
Oh, it's your thumb you mustn't use.
So put your 2 fingers on your radial pulse.
So the radial pulse, for those of you,
inside.
can you see on the camera there?
By your thumb side.
So it's the thumb and then lining with the thumb.
Yes, by your thumb here, radial pulse. You got it?
No, I don't have it.
Just gently, push it gently.
Oh, okay. I was going way too hard.
That's the problem. So in a panic, you push hard. I want you all to push hard.
Oh, and then I can't feel
Goes
anything.
away.
Oh!
Just de-emphasize the pulse. Leave the pulse. Unconscious, no breathing, that's dead.
Okay, and then we call 112.
You call 112, or if you know specifically the emergency service you want, it's in your phone, call them.
Okay, yeah.
Whoever it is.
Yes.
Okay?
Like we will now have you on speed dial.
No, don't do that because I'm not always here.
No, you will be.
So the debacle is, are you private medical aid, so you can use a private service, or your government, whatever, okay? And then tell them what you're dealing with. Someone's unconscious and not breathing. We're doing CPR. Give them the address, okay? And they've got some apps that will know who you are with the phone.
Of course.
And then we're going to act. We're going to do compressions 100 times a minute to staying alive. And we must get these AEDs, guys. You've got 100 times more chance of using this than a fire extinguisher.
How quickly we will throw money at a new cell phone.
100%.
And like, because if you tell someone, let's throw out a number, 30, 40 grand. That's how much most of our phones cost. You say, okay, you're going to spend that amount on an AED. I don't know. I don't know I don't know.
But here's the thing. I've got a finance house that will do a rental for you. So you can pay it off monthly like a cell phone.
Oh, man.
How's that?
That's amazing.
Can I give you my website?
Please do. We need one for the studio, guys.
It's Executive Medical Services, all one word.
Executive Medical Services.
.co.za. There's a landing page there. You'll see all the stuff, my background, what we do, how we help. And that ties into Heart Safe Dolphin Coast.
Again, I'm saying this, I know we will have you back. And if you're open to maybe even like a once a month or something where we can cover the different things because we've got shocks, we've got burns, we've got
bleeding from shark attack, you've got all sorts of stuff.
Oh
choking.
My God.
You've got
you
everything.
need to train us as well.
Yeah,
I want to give
100%. I've got the training lined up. We just get guys together, we do it. No problem.
You know what? That's what I realized. It plays it in. It's all fun and well to be able to play, but I think more than that, if that
and
ability
I will give you
to
a
help.
sticker that says Heart Safe Dolphin Coast on your window.
So people know that we are a place that would have an AED.
Yeah, because if
necessary.
I go into a place at 62 and thank God I'm healthy and not on any medicine, I want to know if I drop down dead if you know what you're doing, because my chance of survival is how much? Not so much at the moment because there's no any AEDs. Crazy.
Oh my God. I wonder even if the Marshall guys right here have got an AED.
I wonder.
I would love to speak to them. They're welcome.
Yo.
All the guys.
Thomas Watson, you are amazing, and we absolutely welcome to the Plays It In team.
Thank you very much.
You're one of us now.
Pleasure. I'm so glad I got to see you
and
guys.
I love his name, Thomas Watson. That's the best.
I'm not the golfer and I don't make that much money, but
all I do is save lives. Quick question before we let you go. If you had to guesstimate, how many lives have you personally been involved in saving?
I've been doing this for 42 years, so it's thousands and thousands and thousands. And I do a talk called Lifesaver 25-550. And that's all about this, but more. So I reckon, I don't even know, but it's in the thousands.
What was the name of the 15-year-old boy that shot you?
I can't tell you that.
No, just his first name, not the whole name. Like a Paul, a John,
Diego.
Okay, thank you, Diego.
Yeah,
Because
Diego did this.
Diego didn't do it on purpose.
No.
But what Diego did was
He launched me into a
he
whole new world.
blasted you into your
Absolutely.
world.
Absolutely.
Are you still friends after?
Yeah, were you friends after?
Yeah, we were actually. But
Really?
we've lost touch. I mean, you grow up and things move on. But there was no grudges. It was an accident.
Sheesh. Okay.
TikTok needs to find Diego. Come back.
I think Diego needs to stay as far away from the word TikTok as possible, actually. This is Radio Plays It In. It is 11 minutes to 9. We will have this up very shortly. Spotify, YouTube, plus we'll put some shorts up as well. Please share it with absolutely everyone because, like we said, hopefully you will never need this information. But in the off chance that you might, you could literally save a life.
Absolutely.
This is Plays It In.